How does TB culture work? Understanding TB types. Imagine trying to catch a tiny, slow-growing bacteria that can hide in your body for months before showing any signs. That's where tuberculosis culture comes into play. It's a laboratory process used to grow Mycobacterium tuberculosis bacteria from a patient's sample, usually sputum, to confirm if someone has active TB disease. The process starts with collecting a specimen, then placing it onto special nutrient-rich media that support bacterial growth. There are mainly two types of media used: solid media and liquid media. Solid media involves spreading the sample on a solid surface, like a petri dish, which helps identify M. tuberculosis with high accuracy. But because these bacteria grow very slowly, it can take several weeks to see visible colonies. Liquid media, on the other hand, involves placing the specimen into a broth that encourages faster bacterial growth. This method can detect TB bacteria in about 1 to 3 weeks, making it a quicker option. Both methods are valuable, with liquid culture often used to speed up diagnosis while solid culture confirms the findings. Once the bacteria grow, scientists can perform tests to identify the specific type of Mycobacterium tuberculosis complex present. This is important because TB can affect different parts of the body, not just the lungs. Culturing also allows for drug susceptibility testing, which shows whether the bacteria are sensitive or resistant to antibiotics. This step is crucial because some TB strains are resistant to common drugs, making treatment more complicated. Drug susceptibility testing can be done using growth-based methods in either solid or liquid media, with liquid methods providing faster results. Additionally, molecular tests can detect genetic mutations linked to resistance, giving a comprehensive picture of the bacteria's profile. Understanding TB types through culture helps distinguish between drug-susceptible TB, which responds well to standard treatments, and drug-resistant forms like multidrug-resistant TB, resistant to at least isoniazid and rifampin. There's also extensively drug-resistant TB, which resists even more drugs. Culture remains the gold standard because it confirms infection, identifies the specific TB type, and guides effective treatment. It also helps monitor how well the treatment is working and ensures that TB isn't confused with other infections caused by different bacteria. In simple terms, TB culture works by growing the bacteria from a patient's sample on special media to confirm infection, determine what kind of TB it is, and find out which drugs will work best. This process is essential for accurate diagnosis, understanding the specific form of TB involved, and planning the right treatment. Always remember, if you suspect TB or are undergoing testing, consult healthcare professionals for personalized advice and care.